Okay, good morning, good evening, good afternoon, doctor, nurses, and pharmacists. I am DrChe, and today we will discuss some important reading tips. So, just let me share the session with other doctor, nurses, and pharmacists. If you can share this session with other doctors, nurses, and pharmacists, those who are taking OET exam, that would be great. Okay. So, meanwhile, I am sharing just we will discuss some reading tips, part A, part B, A and B, if possible, if we get more time. Okay, so just try to share with other your friends the link, if possible. Okay. Okay, okay, hello. So reading tips. Okay, just 1 minute. We're going to start very soon. Okay, so let us start. Okay, so can you see my screen? Can you see my screen?
Yeah, we see.
Yes,
Okay, thank you.
yes, sir.
Okay. So can anybody just quickly point out what is strategy for reading part A? What are the strategies for reading part A? Just quickly, please. No?
Yes, doctor.
Yes, please.
I think just we need is scam
Uh-huh.
part the four text, like
Uh-huh.
just the heading and subheading. If there is
Uh-huh.
no heading and subheading, I think the
Uh-huh.
beginner's sentence of the
Uh-huh.
paragraph, and
Uh-huh.
immediately we'll go to the 37 questions. If
Uh-huh.
we find easiest question to answer, and
Yes.
after that we'll go to question 8 to localize the key point and to realize the exactly the task,
Uh-huh.
and we'll go to find the question, and I think
Uh-huh.
I
Okay.
until I finished.
Yeah,
Yeah.
that's good. That's good. Okay. So first we need to quickly skim and scan. What we will skim and scan: headings, subheadings, topic sentences. Topic sentences are the first sentences of each paragraph. So sometimes last sentence also. If there is a table or any picture or something that we will skim the main thing, important things. Okay. Just quickly, just to get an overall idea what is included in each part. Okay, in each text. It will help us to give answers to the most of the questions in the reading part A, especially from 1 to 7 questions and some other questions also. Okay, and then we will read the question and then we will try to find out the answer. So there are different strategies that people use. Let us do it practically, because just talking and just telling the things would not help a lot. So let us do it practically. Okay. Can anybody tell me what is the main topic of this reading part A?
Leptospirosis.
Leptospirosis. Yeah.
Leptospirosis. Okay, very good. Okay. So this is the main topic. So somebody is telling their small font. So actually I cannot make it too long because then we need to see all the text together on the screen. So that is why. So just if people you find it difficult on your mobile or cell to see the text, so you can just make your mobile horizontal. So maybe you can see a little bit bigger size. Okay. So this is our main topic. So in text A, here they're just talking about what is leptospirosis, just okay, briefly. Here they're talking about two types of, the classification. Can anybody tell me just quickly which type of classifications?
Mild and severe leptospirosis.
Okay, minor spear. Okay, do we need to see the details of these, or just we will go to the next part, or just we need to read the
No,
details?
go to next part.
Yes, that is good. We just need to quickly see the name, mild spirosis, severe, and we can see when there is some question about mild or severe type of leptospirosis. We will come here. Okay, so we don't need to read here. Okay, we don't need to read. Okay, this picture is about leptospirosis, but we don't know what is in the picture. Okay, so you can see here there is numbering 1 1 and 1 here, 1 2 here, then there's 2 here, 3 here, maybe some cycle, or maybe they're just giving some general information. So here they are talking about leptospirosis organism, about say temperature. So here, so what we read here, the bold one. Okay, we will not read the smaller ones, and we will see the picture means there is a sun and there is earth. So slow moving or stagnant water. So this is where leptospira organism may live. Okay, here is the incubation period. We don't need to read it. Just here is the urine. Here is the increases liver enzyme. So the effect on liver here. So here is the dog, and so affecting dogs. So here is the cases were hyperbilirubinemia. Okay, so the cases. Okay, so here fatal leptospirosis, what it can be survival rates, and dogs in urban areas, and here is the phase of leptospirosis 1 year. Okay, so we will just quickly skim and scan. We don't need to go to details. Okay, so text number 2, text B. So can anybody tell me what is the main thing in the text B? Those who are on Facebook, you can also participate. You can write things in the chat. I'm seeing your chat here. So quickly,
Pathophysiology.
pathophysiology. So pathophysiology, how what is the process of this infection and how it spreads. And this is pathophysiology. Okay, so we will just quickly read a scheme and scan. Okay, so leptospirosis can invade non-intact skin and mucous membranes. This means contact. Okay, so exposure. So historically, water. Okay, so like this. Okay, organism is shed in affecting animal urine. Okay, this is 16 days can survive in there. Then human beings, and then transmitted across placenta, and then once within the body, what it does, okay, goes into the blood and all of these things. So use 1 to 2 weeks to be infected person to begin to show symptoms. Okay, then is okay, so this is pathophysiology. Okay, so if you find one question related to pathophysiology, you will quickly come to this. Okay, so then can anybody tell me, so what is in taxi? Who will skim and scan taxi, please, quickly? Dr. Sharil, can you do that?
Hello.
Yes, please.
So can you repeat that?
Can you skim and scan taxi? So what is important in taxi? Just quickly, can you skim and scan and tell us what is important, what is not important?
Um, the two syndromes are clinical syndromes, enteric and
Yes.
anecdotal.
So history and physical. Okay. So comparison to distinct syndromes. Okay. There are two types of ecteric and anecteric. So here they are talking about anecteric. Okay. Self-limiting, and these are the symptoms, 90% okay of cases. Okay. So anecteric. So still they're
Yes.
talking about in both of first paragraph, they're talking about this. Okay. Syndrome can also have recurrent, this and called immune stage. And so that's okay. So then they're talking about the other phase, ecteric. Okay. This is also called this, and then there is severe infection and so all of these things. Okay.
Yes.
So this is quick. Okay. So then we have text D. Text D. Dr. Zartash, can you hear me?
Yes, sir.
So can you skim and scan text D, please, quickly?
Yes, sir. In text D, it is treatment and prevention, leptospirosis,
Treatment and
And,
prevention. Very good. Very good.
and it is telling about the damages of the organs, liver and kidney.
Okay. 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 So this is the effect on kidneys, and they're talking about antibiotic and supportive care.
And
So here they are
vaccine
talking about vaccines.
vaccine
We don't need to
approval.
go into the detail, just vaccine. They're talking about in this paragraph about vaccines. So here they are talking about some risks. Okay. So these are the measures that we can do prevention. Okay. Antibiotics, just avoid contact, urinate home, quickly clean, and encourage dog to urinate away and wash hands. Okay. So these are the 4 texts. Okay. So we have overall little bit idea what is included in each text. Okay.
Yes.
Then some people start with 1 to 7 questions, and some people find it easy to start with question number 8. And then they finish 20 questions, then come back to question number 1. So you can try both of these strategies. Sometimes try with question number 1 to 7 and then continue in sequence. Sometimes you can try first 8 to 20 questions and then come back to first 7 questions. So some people find it easy. So one of these both ways. Okay, so try both of them and try to find what is better for you. Okay. So for this class, we will go in chronological order, means just, in sequence. So Dr. Zartash, just continue. So where you will try to find this answer, where a pet should urinate. Just tell me where it is possible, okay? All other people just write in the chat, okay? Don't tell me. That was Zartash, don't tell me. All of you just write in the chat, and those who are on Facebook, write in the chat, please, in which text it is possible. In which text is possible.
Sir, the text A and B I have not seen, so sorry.
It
I
is
don't-
possible in A and D, okay? Good. It could be in A, it could be in D. So out of these two, Dr. Zartash, where is it is, you know, where you will go first, in A or D, where you think that is
A.
more in A. Okay. So just remember the question is where a pet should urinate, okay? So it is not possible in these texts, okay? It could be in structure. So in picture, just try to find here. This is they're talking about, you know, water and soil here, the environment here. They're talking about infect on liver here, hyperbilirubinemia, and here the fatal cases here are most commonly infected through contact with rodents. Okay. So Dr. Zartash, can you find here?
Yes, sir. In here, I can find.
Where?
Sir, in number 2 here.
In number 2.
Sir, dogs in urban areas are.
Okay, here, this one, this one.
Yes.
Dogs in
Yes.
urban areas are most commonly infected through contact with infected rodent urine. Okay. So the question is,
Oh, no.
where a pet should urinate?
Rodents are not pets.
Do you think it looks like somewhere like prevention, something like that?
No.
Let us try in D. Okay, try to find in the prevention, please.
A4, sir. Dot.
Okay, Dr. Zartash.
I
Yes,
think
sir.
fourth bullet point. Sorry.
Dr. Zartash, where you can
Yes,
find
sir.
the answer?
Sir, I can find here.
In which bullet
Sir,
point?
if
Which
your
bullet?
dog urinate in your home, clean.
No, fourth,
Sir,
sir.
third
Fourth
number.
bullet point.
So if your dog urinates in your home, clean the
Yes.
area where the household is infected and wear gloves to avoid skin contact with the urine.
Yes, this.
Is this the answer to where a pet should urinate at home?
No.
No,
No.
fourth. Sir, fourth. Encourage your dog
Fourth.
Fourth.
from
Fourth.
the
Okay,
standing
good.
water.
Okay, very
Away.
good. Okay, very good,
Yes.
very good. Okay. So the next question, who will answer? Dr. Aftab, can you answer the question next one? Dr. Aftab.
Yes, sir. Which
Okay.
question? Which number?
Okay. So this is the
Okay.
question. Classification of
classification.
leptospirosis according to skin color.
Classification of the leptospirosis. It should be in the.
Just wait, please. Wait, please. Write in the chat.
Yeah.
And let other people write in the chat. Please let other
Yes.
people write in the chat. Where in which text is possible in A, B, C, or D? Just please hold on. Hold on, please. Please
yeah.
hold on. Write in
Yes,
the
sir.
chat, okay? I will ask you, but later on. All of you write in the chat in which text it is possible in A, B, C, or D.
In the C, sir.
Please, in the chat, please.
So
So most of you are saying in text A.
yeah, I am saying, sir, C.
So you are saying C, but most of you are saying A, okay. C, no, C. So it means it's possible in C or A, okay.
Yes.
So let us go to A. So this is you need to differentiate. There are classification is given at two places, okay. One is in the text A, that is mild and severe, and other one is in text C, that is ecteric and anicteric, okay.
Mm.
Anicteric will not show any color. So ecteric phase is well known as is a severe infection manifest with fever and jaundice, okay, jaundice, hemorrhage and respiratory distress, okay. So which classification, Dr. Aftab? So according to your opinion, the answer is in text A or in text
C, sir.
C?
Yeah.
So why not text A?
Because skin color should be changed in the jaundice.
Yes, skin color changes in jaundice, and they are not talking about anything about skin color in mild and severe, okay. So even we can read here organ failure and this and that, okay. So if I change the same question, Dr. Aftab,
Sir.
classification of leptospirosis according to severity.
That should be type in the A, text A.
Okay, thank you. So Dr. Humayu is with us on Facebook, and thank you so much for just visiting our class. He has passed OET, and he just comes here just to comment and to encourage us. Thank you so much, Dr. Humayu. He joined our VIP hybrid course for writing and speaking also. So Dr. Humayu, thank you so much, and wish you a happy life ahead. Okay, just due to Ramadan and these things, Dr. Humayu, we were not taking free classes, but now we will be taking frequently free classes. Okay, so if I ask Dr. Aftab according to severity, so what should be the answer? In which text it is possible?
Severity type is in A, text A, sir.
In text A, okay. So please don't just see the types of leptospirosis here and just give the answer. See what exactly type of leptospirosis the examiner is asking about, okay. Please be careful, okay.
Yes, sir.
Okay, good. Okay, so effect of leptospirosis on unborn babies. So let me see who will answer this question. So Dr. Saad. Dr. Saad, can you hear me? No? Okay, so if you want to participate, you can unmute. Okay. Okay, internet issue. So anybody else who wants to participate can unmute. Question number 3. In which text it is possible to find the answer?
It may be C.
Okay, so you will, yeah, Miss Manuri, okay,
Manuri,
Dr. Manuri.
yeah.
Okay, so effects of leptospirosis on unborn babies. So where it is possible to find the answer? It looks, it's not like in the last we have management and prevention. Just people write in the chat on Facebook or on Zoom. So where it is possible to find the answer, in which text? Question number 3, in which text? Just quickly, please. Where it is possible? Please write in the chat, please, quickly. We have very short time. Okay, no idea. Nobody has given any answer. No idea. Okay. So in text A, if you see, they're not talking about effect on any specific age group. They're just talking about in general, okay? Sign and symptom section, pathophysiology, history and physical, treatment, history and physical, ecteric and ecteric, treatment and prevention. Okay. So no, this question should be solved by all of you, okay, not by me, please. Where it is possible.
D, sir, D. Prevention.
D, okay. So let us go with Dr. Aftab. Dr. Aftab, yes?
Yes, sir.
Okay. So Dr. Aftab, you will try to find the answer in D, okay?
Yes, sir.
So this is your question. This is your text. Try to find the answer, please.
I couldn't find, yes.
No, not here.
No, I couldn't find, yes.
Okay, so option D has gone. So now where we should go? Some people are saying C. Okay, so some people are saying C. Okay, so Dr. Aftab, you will continue helping us. So try to find answer in text C, please. Dr. Aftab.
Yes, sir. I will try.
Okay. What are your keywords? What you are looking for, Dr. Aftab? What you are looking for?
Sir, I'm looking for transfer in the baby word.
So you are looking unborn babies, okay?
Yeah, yes, sir.
And effect of leptospirosis.
Yes, sir.
Okay, are you able to find answer anywhere?
I also couldn't find.
I think no, not here. Okay.
Yeah, I couldn't find, sir.
Okay, let us try in B now. Okay.
Okay.
This is you people can see how the examiner makes the question. It was not easy. It was just a little bit more or less. Okay. So you can just go in D in C or D. Okay. Classification question was very easy. Though this one is a little bit, difficult to find. It's not difficult, but it's difficult to find the in which paragraph is there. Okay. So this is your question. This is your text. Try to find in C, please. B in B.
Here it
Yeah,
can
where?
also
Second
be,
paragraph, sir.
Where?
it can
Second
also
paragraph,
transmit
sir. It can also. Yes.
across the placenta of an infected human due to the pregnancy. Here, yes, sir. It can
This
be
one?
transmitted. Yeah.
Here, it is here. Okay.
Yes, sir. Yeah.
Leading to miscarriage in the first 2 trimesters, and during the 3rd trimester, pregnancy can result in stillbirth or intrauterine death. Okay.
Yes,
So,
yes.
effect of leptospirosis on unborn babies. I am using the same word, unborn babies.
No, he's not using same words.
So, those who are in the 3rd trimester, those are in the 2nd trimester. So, if there is an effect of leptospirosis on them. So, this is what we are talking about.
Yes.
Was it easy to find in just to get an idea in which text is possible to find this answer? It was difficult, okay?
Yes, sir.
As you will spend, this is the game of timing, okay? Reading part A is the game of timing, okay? So if you are able to answer all the question in time, you have 20 questions, you have only 15 minutes. So keep in mind all of these things, please, okay?
Yes, sir.
We have 20 questions and we have 15 minutes. So less than 1 minute for each question. Okay. So Dr. Suman, you will answer next question. Okay. Dr. Suman, mention
Yes,
of a
sir.
research. where you can find mention of a research. So what synonyms you can see instead of research? People can write, you can write synonyms of research. What else? What other words they can use instead of research? Synonyms. Dr. Suman,
Invention.
what?
Study, sir.
Studies.
Study. Okay, one is study, other.
Invention. Invention.
Okay, so Dr. Suman, where you can find the answer? In which text it is possible? Okay, just possible.
D, sir.
In D. Very good. Let's go. Okay. Other people, what do you think? In which text it is possible? So here is your text D, doctor, and here is your question. Last one. Try to find the answer, please. Just quickly, in this part, it is not possible. They are talking about prevention, okay? And here
No,
they're
no,
talking
sir.
about treatment. Here they're talking about treatment.
I cannot see, sir, in D.
I think in D it is not possible, okay? Then where we should go now?
A.
Just think,
Yes, sir.
Dr. Suman, just think in where it is possible of research, any research. Where it is possible. Here they are talking about history and, icteric and anicteric. I think it is less, there are less chances here.
Treatment,
In
sir, treatment.
pathophysiology possible, maybe in pathophysiology, and maybe
No,
in
no,
text
sir.
A. So where you should go now, doctor? According to you, we will go according to you.
A, sir.
A. Okay.
History.
So first I will show you this part. Okay. So you will try to find here, then I will show you the column, okay, the diagram.
No, sir. No here.
Not here. Okay. No, I will show you. Just the question is the mention of a research. Okay. So let me make it smaller. Okay. Okay. If you find the answer, just tell me that you found the answer. Don't tell me the answer, please. Okay. Don't
No,
tell
sir.
me the answer. Just tell me where you
No.
you
No,
cannot
sir,
find
no.
the answer. Okay. Anybody else is
No, sir.
able to find the answer? Just tell me yes or no. If you found the answer, yes or no. Don't tell
Yes,
me the
sir.
answer, please. Okay.
Yes, sir.
Okay, you got it. Okay. Thank you. Anybody else got the answer? Anybody else got the answer? Okay, so
More
Dr.
than
Suman, just try to find again. Try to find your
more.
keywords. Try to find synonyms, keywords.
Sir, three, sir. Three, number three. More than 2/3 of this.
त्यांचं काय नसतं त्यांनी क्लासमध्ये काय शिकवतात बघ ते तेवढंच आणि काय तर एक्स्ट्रा भेटतो देते तर त्यांचं मटेरियल काय आम्ही इथं घेऊन यायचं नाही काय नाही
Which
मग आम्ही
language?
इथं
Which
काय
language this one?
करायचं प्रॅक्टिस
Which
Sorry,
language
sir.
this one?
करायचं
In
Which
one,
language is this
one
one?
study. Hello.
Which language is this one?
It's Marathi.
Marathi. Okay, good. Okay,
Online
so
त्यांनी
Three, sir.
सांगते
In one study, 80% of dogs with
online.
leptospirosis with increased liver and the levels.
so very good, Dr. Suman. Here is your answer. In one study, 80% of dogs with leptospirosis had increased liver enzyme levels. So this is the mention of one research, one study. Okay.
Yes, sir.
So here. Was it easy to find?
I think it is easy because general question, it is not
But you will spend
specific.
time. You will spend some time, to be honest. Okay. It's not straightforward that you will come and directly you will find the answer. You will struggle a little bit. You will spend a little bit time to find the answer to this question. Okay. So the examiner is making a little bit in general, is not too specific in which text you can find. Okay. So that is why some question would be very easy. some question would be a little bit difficult to find. So this is the game of timing. Questions are not difficult. This is the game of timing. When you are spending a little bit more time, means this question is a little bit difficult, okay? So now who will answer next question?
Yes.
Miss Farah, can you do that? Miss Farah Naz?
Yes, Assalamualaikum. I just joined the
Waalaikum
session.
Okay. Okay, no
Yes.
problem. So let us
But
take somebody else.
if you will show the text, then I can try.
Okay, so I will show the text. Survival rate after effective treatment. Okay.
Okay.
I will show you quickly. This is leptospirosis. General information about leptospirosis. Maybe somebody else has joined recently. Types of leptospirosis, mild and severe. Then they're talking about in general information, leptospirose organism, incubation period and where they live, the organism, and how it infects and how it, when it is fatal, when it is, dogs in urban area, these things. Here they're talking about pathophysiology, how it spreads, it comes with contact to skin from urine, and then it goes to water and then to organisms. So this is how it pathophysiology, okay? Here they're talking about two types of syndromes. One is ecteric and anicteric. It means two types of classification. Ecteric is without jaundice. Ecteric and ecteric is with jaundice, okay? And the last one is treatment and prevention. So this is the treatment, antibiotic supportive treatment, and then they're talking about prevention, okay? Antibiotic and avoid contact with urine, all of these things, okay? So now tell me, survival rate after effective treatment, where it is possible, in which text is
It
possible?
is in the text D, treatment and prevention.
So it is possible, not in there.
Yes.
Possibly,
Yes.
okay.
Yes. It's possible. Yes.
Okay.
But
So
I
if you
think
find the
it's
answer,
in A. In A.
just if you
I think.
let us go with her. So if you find the answer, just tell me I found it. Okay, don't tell me the answer.
Okay.
As the word treatment is given there, most of you will go with text D. Okay, most of you. So try to find there. You cannot answer until you find the exact answer there. Okay. So what you're looking for?
Survival rate.
Yes.
I think.
Survival
What are your
rate.
keywords? Survival rate.
Survival rate. Yes. And obviously effective
treatment. Okay. So what synonyms can be instead of survival rate? What synonyms they can use? They can use different words. Okay. Try to find the answer, please.
Yes. Okay.
In this part is not possible because they're just talking about prevention. Okay. In this part. Anybody can find answer here in this text D? Anybody can find answer here?
No, I could not find.
No.
There is a sentence, the chances of recovery, but it's not the survival rate actually.
Okay, very good. So where we should go now?
Yes, sir.
In the text A.
Okay. So let us give a chance to Miss Farah to find the answer. Try to find in this part of the text A, then I will show you the table. Okay.
Okay, thank you.
No, sir.
Not here, I think.
Not here?
No.
Not here.
Okay. So just read the question once again, because I cannot show question again because the table is long, the diagram is big. Okay.
Okay.
Survival rate after effective treatment. Okay. Nobody else will give the answer. Just let the Miss Farah find the answer. Okay. Miss Farah, you will just tell me I found the answer. You will not write the answer. Other people can write in the chat. Okay. Other people write in the chat your answer, please. Okay.
Yes, it is more than 80%. Survival rates with treatment are
What I
reported
said.
to be more than 80%.
What I said, Dr. Miss Farah, what I said. Once you find the answer, tell me I found the answer.
Yes, okay, sorry, I found the answer.
Okay,
Sorry.
no problem. Okay, so the answer is survival rates with treatment are reported to be more than 80%. So after treatment, more than 80% is the survival rate. Okay.
Yes.
So if you do very good quick, very good skimming and scanning at the start. So it is very easy to guess in which text you can find the answer. Okay.
Okay.
Okay, so just continue, Ms. Farah. In which text is it possible to find the answer to this question?
Yes, it was the paragraph, I think, B, in which there were
Just tell me the
two
text.
types,
In which
C, I
text?
think, the
Just tell
types of
me
yes,
type or
it's the
types of
text
medication.
D.
Text.
D, medication, treatment, I think so.
Okay. So where it is possible to find the answer to this question? People write in the chat, please. In D? So as
Yes,
it is
D
treatment,
delta.
most probably it will be in D. So
Yes. Yes,
where is
it's
the answer?
first bullet.
First bullet, antibiotics.
Get administer antibiotics as prescribed by your veterinarian.
Okay, so antibiotic is type of medication, okay? And which type of medications for the treatment of leptospirosis?
First line as well, that it's generally treated with antibiotics and supportive care.
Okay, just now fill in the blank. What you will write? Fill in the blank.
Okay.
Fill in the blank. All of you write in the chat, okay? What you will write if it is a fill in the blank question? What you will write in the fill in the blank? Okay, write in the chat, please. Somebody has written tetracycline. In OET, when you are giving answers to reading part, you cannot use your own knowledge, okay? You will only find the answers from the text, okay? You cannot use your own knowledge. So tetracycline is not written anywhere here. So people on Facebook, you are not going to write anything in the chat? No? Okay, no problem. Okay. So most of you are giving wrong answer. Supportive care is not a type of medication. Is wrong,
Exactly.
okay? Supportive care is wrong. Vaccine is not a type of medication. Mostly vaccine they are used as vaccine, separate thing, okay? Prevention. This is not a treatment. Vaccine is not the treatment, it's the prevention. So the answer should be antibiotics. These are the type of medication. Antibiotics is the answer, not a vaccine, not supportive care. Please be careful, okay? Okay, so now let us take Dr. Zartash.
Excuse me,
Yes,
doctor,
please.
I have a question here.
Yes, please.
Because they put like type or types. Is antibiotics is plural, singular, or what
So
it means? Yeah.
what the examiner is doing, if I only write type, so then most of you will give only one answer. So I am using type or types, so it could be one thing or it could be more than one thing, okay? So I'm giving options. So you can use singular thing, you can use one thing, you can use more than one thing, okay?
Yeah, okay, thank you.
So mostly they do like this in the real exam. So now next question you will be answered by Dr. Zartash, okay? So in which text is it possible to find the answer, Dr. Zartash?
Sir, can I see the text ABCD? I'm not seeing here.
You will not see like this. You need to just guess, okay? Guess where it is possible. People help her, just write in the chat where it is possible.
Okay.
Where it is possible, in which text? Okay, so Dr. Zartash, some people are saying in A and some people saying in C, okay? So where you want to go first?
Sir, C.
C, okay, good. Let us go to C. No, okay, yes, okay. And C, I think is not possible. Try to find here. I think it could be A or B, okay? They're just having two types of syndrome in C, okay? Ecteric and anicteric. I think there will be no mention of source of infection or here, okay? Let us go for B and A, okay? So that is Satash, try to find in B, okay? And if you find the answer, don't write, tell me the answer, just tell me that I found the answer. What you looking for? What are your keywords?
Sir, should I write in the chat or I speak?
Just tell me what you're looking for. What are your keywords?
Sir,
Infection
bacteria go in
for
lymphatic stem.
dogs.
Okay, so are you able to find the answer? Dr. Zartash?
Yes, sir. Source of infection. Sir, I found.
What is the answer? Which paragraph, which line?
Sir, second paragraph.
Second paragraph. And
And sir,
this paragraph and which line?
sir, first line.
First line. When the organism is shed in the infected animal's urine, it can survive in fresh water for up to 16 days and in soil for almost 24 days. It can enter the human host through open wounds, mucous membranes, and lung. Okay. Is there any mention of dogs here?
No.
No, no.
And source of infection or dogs in cities?
No.
No. So I think
No.
answer is not here in this text. Okay.
It's not in B, sir.
So let us go to A. Okay. Answer is not in these texts. Okay.
Okay.
Not here. So let us go with
But instead of
picture.
dog, they are mentioned
What?
animals.
Yeah. So,
Instead
okay.
of
So we need to find the exact. Okay, Dr. Zantash, once you find the answer, tell me that I found the answer. Nobody will tell you. Okay, other people can write in the chat. Okay, if you find the answer, tell me in the chat.
Okay.
If anybody finds the answer, tell me I found the answer. Just
Found the
tell
answer,
got
sir.
it.
Yes, I
Just
found.
got
Yes, I
it.
got it. Yes, I got it.
Okay. Okay. Let us wait for Dr. Zartash. Write in the chat. Write as the fill in the blank. Okay. Write it as fill in the blank. Write it as fill in the blank. Okay. Write it as fill in the blank. This is Dr. Abdullah Khan. This is not the answer. Yes, this is the area. This is the place, but what should be your answer? Dr. Zartash, what is going on? What are your keywords? Dr. Zartash. Are you there?
Yes, sir.
What are your keywords? What you are looking for?
Sir, I'm writing.
You are writing. Okay, just tell me. No, it is time to answer.
Infected with rodent urine. Dogs in urban
Very good.
areas.
Where is the answer? Where? This part, okay?
In and
This
table.
part, okay? Yeah, in the table here. Second last, okay, here. Dogs in urban areas are most commonly infected. Most commonly, you can see, most commonly infected with. So dogs in urban areas, what synonym I am using?
City.
Cities.
Cities, okay? I'm not using the same thing, okay? Cities. Dogs in urban areas are most commonly infected through contact with rodent, infected rodent urine, okay? So if it is fill in the blank, the answer should be, even I am not using, I'm instead of infected with, I'm using source of infection. You can see how I'm using, synonyms, I'm using paraphrasing, different language for the same thing, okay? You can see here, most commonly infected through contact with this, okay? So I'm using source of infection for most of the dogs in the cities is, okay?
Yes. Rodent.
So infected rodent,
Yeah. Urine.
urine, okay?
Yeah.
Okay. So now we will go to the fill in the blanks, okay? Before we go to the fill in the blanks, just let me show you one thing. So then we will continue, okay? Anybody is in the class with on Zoom with us who has joined my VIP habit course for writing?
Yes, sir.
Anybody is in? Yeah. Anybody is? Are you happy or you're disappointed with the course?
No, sir, I haven't joined the VIP one. I'm just.
But you're getting feedback.
Yes, sir. I'm happy with the
Are
feedback.
you improving?
Really good. Yes, sir.
Okay, good.
Thank you.
Okay, good. So you also okay, Miss Yumanji, and she got B grade. She got B grade in writing, but I'm afraid for next attempt. Okay, she got problem with other modules, but in writing she got B. So once you book your next exam, please try to send letters, okay, to get feedback. You don't need to pay extra, okay? You don't need to pay extra.
Thank you.
So we have a course. In how many letters you got corrected by me, Dr. Miss Yumanji?
I think more than 20 letters I got correct.
I think it should be more than 30, I think, because you are
Yeah,
complete
yeah,
almost both
yeah,
files,
yeah,
okay?
Yeah.
In the course, you have 14 letters, two referral letters, two urgent referral letters, three discharge letters, two letters to non-medical professionals, one letter to pediatric patient, one letter in which there are two patients, and one letter GP to GP transfer in case of nurses, one community nurse to other community nurse transfer, okay? So this is the course, and it is 14 days, and your letters will be corrected by myself. You will get model answers written by myself, okay? So course is in 100 British pound. After 30% discount, you can pay 70 pounds only. And in most of the cases, once you finish this file of 40 letters, I mostly send to my students another file in which you can write 20, more than 25 letters, almost more than 20 letters more. And I don't charge anything extra for those corrections, okay? So it means you can get enough feedback to get B grade, okay? So speaking feedback is also available if you need is individual feedback. So is also available. Okay. So let us go to the next question. Question number 8. So Ms. Jivant, you will answer this question. Risk for long liver damage or dash is higher even after quite appropriate treatment. In which text it is possible to find the answer?
Test D.
Just write in the chat, please. Where it is possible?
D.
D, okay. Most of the cases it will come D, okay, in our mind because they are talking about treatment and D, okay. So, but let us try to find the answer there. Okay, try to find the answer. What are your keywords?
Liver damage.
Okay.
First para, sir.
First para.
What is the answer?
Damage. Okay. Let's do a permanent.
Or residual kidney.
Residual.
Yes, permanent residual kidney. Okay, a little bit we need to reorganize the the words, but the answer is there are two things that there is still risk. Okay, permanent residual kidney or liver damage. Okay, so we will write a permanent residual kidney. Okay, is higher.
Okay.
Even after quite appropriate treatment. Okay, so when treated early or aggressively, this is appropriate treatment. Early and aggressively, and the chances of recovery are good, but still there is risk of permanent residual kidney and liver damage. So our answer is
Residual.
kidney. Okay. Okay, so let me take somebody else. Anybody who has not participated so far and wants to answer? Dr. Manuri or Miss Manuri? No? Anybody else? Priya? Miss Priya? Priyanka? No? Dr. Suman?
Sir, my
Yes.
connection is better.
Okay, Dr. Saad. Okay.
Yes, sir.
So question number 10? No, sorry.
Nine.
Question number 9.
Yes, sir. Sir, I think maybe in text A, I think we can find.
Text A?
Yes, I think so.
Okay. What are your keywords?
Sir, traditional way it's spreading, but it's not a traditional way it's spreading.
It's okay.
Leopard
Something that is not traditional, but it is
Yes, sir.
causing more spread. Okay.
Yes, sir.
Okay. Try to find in the text past.
Yes, sir.
And not there. Okay.
Okay, sir. Maybe
In the table. Okay.
yes, sir. Sir, I don't think it's in this text.
Not in here. Anybody can find the answer here in this. We should use the same word that is there in the text. Somebody asked, can we use renal stone of kidney? Use the same word that is there. So where we should go, Dr. Sadh now? In which text we should go? And D is not possible.
No, sir, not in D.
Let us
Pathophysiology,
go
sir.
to B, okay? Let us go to B, okay?
Yes, sir.
Try to find the answer here, please.
Yes, sir. Sir, I found it. It's in the first paragraph, last
Okay,
sentence.
let us give other people
Oh, sorry,
chance.
sir.
Other people. Okay, try to find the answer, other people, please. Yeah, text is B. Here you need to fill in the blank, okay? Fill in the blank with a word or some words. So just quickly, please, quickly. Miss Farah,
Yes, sir. I'm searching the
what is
exact
your
word.
answer?
I have found the answer.
Yes,
Uh,
but what is the exact answer?
Yes, the exact word I'm searching to put in the fill in the blank.
Okay,
Just a
let us
second,
wait
please.
for you. Okay. So all of you write in the chat, okay? Nobody will tell me. All of you write in the chat what should be written here. You people found the paragraph where you can find the answer. Now write in the answer in the chat what should be the correct answer. Please don't tell me, just write in the chat what should be the answer. People on Facebook, Miss Rabia, how are you? So all of you write in the chat what should be the answer, okay?
Yes, sir. It's
What
in the
should be the
last row.
answer?
That upswing.
Wait,
Upswing is the
please wait. In the chat,
okay.
only.
Sorry.
In the chat,
Okay.
please. Write in the chat what is your answer. Okay, let us see. So, Miss Farah, what is your answer?
Yes, sir. Answer is
What is your answer?
yes, it is in the last row mentioned that more recently the United States has been an upswing, and upswing is the synonym is the increased in occupational exposures from agriculture workers. So occupational exposures is the answer, I think.
Occupational exposures, no. It is not the answer.
Agriculture.
Increased agriculture workers.
They are the source. They are not in them. They are the source of infection, okay? See, there is an upswing in occupational exposure. I have seen an upswing in exposure from agriculture workers, okay?
Okay. In United States?
United States is the answer. You can see the word in.
Yes, it's in United States.
In
Yes.
United States, okay?
Yes.
So where you can find it is not traditional way of spreading. Where you can get this idea, it is not traditional
It's
way.
because it's mentioned that historically exposures were primarily from
historically means
recreational waters. So,
classically.
yes,
Classically.
it is
And another thing is,
it is traditional.
yes, if you don't find the historically even, when they say it, but more recently means this is the current one, but is something opposite.
Yes,
okay?
exactly.
So
yes.
yeah. So please be careful. Sometimes you can find the place where is the answer, but it becomes difficult to find the exact what you're going to write. Then you should be grammatically it should fit there, and by meaning it should fit there also. Okay.
Fine. Thank you.
Okay.
Yes.
Anybody has any doubt about this question? No?
No, sir.
Okay, so next question will be answered by Dr. Aftab.
Yes, sir.
Okay, where it is possible.
The
water and dash containing leptospira can be the source of infection.
Diagram A.
Okay, let's go to A diagram. Very good. So I cannot copy here. Just try to find here. Okay, water and something else. So let me copy here. And containing leptospira can be a source of infection. Okay.
It's not here.
Just tell me I got it, okay? Don't write the answer. Other people write the answer in the chat.
Yes, sir. I got it.
Did you get the answer?
Yes, I think, yeah.
So write in the chat, what is your answer?
A question I want to see. Question. I want to see the question, sir.
Here is the question.
Water and fish. No, sir. No, not here.
Anybody got the answer?
Yes, I think it's urine.
Okay, Miss Farah, okay. The water and urine
Yes.
containing glycerol can be the source of infection. So in which part you can find the answer?
In point 2.
Point 2?
In point 1, it's
This part?
mentioned already about water, and the second point mentioned there is in bold letters urine.
Okay. Okay. So if I make this question like this, in which text you can find the answer? So what you will say?
It's text A.
Text A, okay. Now let's go to text B, okay?
Okay.
Okay, so just tell me if you find the answer here or not. Just don't tell me the answer. Okay.
Okay. Yes, I have found.
So don't tell me, okay? Wait.
Okay.
Other people write in the chat what should be the answer here.
Yes, sir.
Write in the chat, please, the answer. Only soil is enough, no need of contaminated soil, okay? So it contaminated for both of them, water and soil, okay? So Miss Farah,
Yes,
so how
it's
you were able to find the answer here?
because
You
it's
just don't
mentioned.
need to guess. You just don't need to guess. You need to find the keywords. Can you find all the keywords here?
Yes. Yes, keyword
No.
was for
Can
me
be
it
shared
was
in urine for months?
no,
Can it be viable for
because
months?
it's
You can find all the keywords, okay? The water and dash
okay.
containing leptospira can be the source of infection, okay?
Yes, both contains
So,
can. Yes,
yeah, but this is not the answer, okay? The answer comes
exactly.
like this. Don't guess. Try to find.
Okay, it's here is sometimes, the word sometimes, and can even be acquired. So in this point, the water and dash containing can be the source of infection. So I'm doubted about sometimes and even word. Hello.
Can you hear me now? Sorry, I got issue with the internet. Can you hear me?
Yes, we can hear.
Oh, okay. So Dr. Zartash, can you hear me?
Yes, sir.
Okay, so you will answer this question. More than 66% are infected with leptospira R. In which text is possible? In which text is possible to find the answer to this question? Dr. Zartash.
Sir, can be B or C.
Let us go to A. Okay. Try to find the answer here. What are your keywords?
66% infected.
More than.
Okay.
More than.
Okay. Can you find something like that here?
Sir, 1.2.
1.2 where?
I think 3.
Just write
Sir,
in the,
please,
you know, what
repeat
should
the
be the
question.
answer? What? This is the question. Please don't tell
Okay.
me, just write in the chat. If you find the answer, just tell me I got it, write in the chat, okay? If you cannot find in text A, we can go to other text, okay?
Yeah, yes, I have found.
Anybody else found it or not? If not, you can go to the other text, okay? Up to 50% of dogs. So write in the chat, what should be your answer exactly?
Sir, check please chat. I don't.
Chat, okay. Okay, other people write in the chat, please. Miss Farah, write exact, this is fill in the blank. This is not just text, okay? This is a fill in the blank, okay. Let us wait for the other people on the Facebook. What should be the answer? Okay, so Dr. Laila, can you hear me?
Yes, I can
So what are
hear
you
you.
gonna answer?
I thought about number 3 in one study, 80% of dogs that area, because they have already used with leptospirosis, and then I thought had increased liver enzyme levels.
Okay, so more than 166% of infected with leptospirosis are, okay.
Are, yes, and
Or what?
enzyme levels.
Or dogs? What should be the answer? Dogs?
Not yeah. Yes, dogs. More than 60 dogs. Yes, enzyme levels. Are
Okay.
dogs? We're talking about dogs. Yes.
So Dr. Suman? Dr. Suman?
Yeah, I think, sir, it is azotemic.
Here?
Yes,
most means 87 to 100% dogs with leptospirosis are azotemic. So more than 60% infected with leptospirosis are dogs or azotemic. No.
But in number 3, they mentioned with leptospirosis. This is one of the key too, and 80%.
Try to find something 60%, okay, more than 60%. This is your keyword.
Okay.
It could be some synonym of 66%. Dr. Laila, can you give me some synonym of 66%?
It will be 2/3, yeah.
Yes, 2/3 as well, of course.
2/3.
So what should be the answer, Dr. Laila?
Yes, I can see that hyperbilirubinemia.
Okay, so your keyword is matching here, more than 2/3 of the cases. So more than 60, this just I'm using synonym of 2 by 3rd. Just
Yes,
using synonym of 2 by 3rd, okay?
Yes.
Nothing else.
Oh, yes,
Okay.
it's exactly 66. Yes. 2/3
Yes.
exactly 66.
This is how the examiner makes you fool, okay?
Absolutely.
This is, you will spend a lot of, you will try to find very 66%. Okay, so more than 80% is more than 66. Okay, it could be the answer. No. They don't make, you know, things vague like that. Okay, you can think that it must 80%. 80% is more than 66. Okay, it could be, yeah.
Yes.
So 87 could be is more than 60. Yes, it no. They don't make things over general. Okay, you will find something exact there. Okay.
Yes, this
So
is
2 by
exactly.
3rd is, yeah, 2 by 3rd is more, even it is written more than, okay, more than written here, more than 2 by 3rd, okay, so more
Yes.
than 66%, okay.
True. Yes.
Okay.
Thank you.
Yeah. Any other question? Any question? Anybody has any question?
Sir,
Enough for today because we have class also.
sir, I have a
Yes.
question.
Yes,
Sir, what if we, is there any other way that we can attempt part A? Like, should we read all the text quickly instead of just,
actually,
yes, sir.
yeah, it depends. You can try these things, but don't try in the real exam, okay?
Yes, sir.
Try before exam.
Yes, sir.
This reading the whole text and then attempting the question, this works for somebody who is really good at reading, okay?
Yes, sir.
If somebody is like me, so for us is like strategies, okay? Just quickly skim and scan, find the main things, okay? But if you
Yes,
read
sir.
all the text, you know, complete, then almost you will spend more than 5 minutes here, okay?
Yes, sir.
6,
Yes, sir.
7 minutes. So then you cannot answer 20 questions in 6, 7 minutes, okay? Because we have only 15 minutes, and part A is the key to success in reading.
Yes,
If you
sir.
are able to get 19 out of 20 or 20 out of 20 in reading part A, then your chances of pass are very high, okay?
Yes, sir.
Okay.
Thank you, sir.
So maybe tomorrow we will arrange some other class, free class. If you have any questions, if you want to join our writing course, speaking feedback, you can contact me. You have my WhatsApp number. Thank you so much, all of you. Okay. Thank you so much.
Okay. Thank you so much, sir. It was a wonderful
Thank you.
class. Thanks a lot.
Thank you, Ms. Farah. Thank you.